Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. 9 out of 10 people that come to the Hauser Neck Center have balance issues. And even this morning, I'll be honest with you, I was working, I did some exercise this morning. I was working on my own balance. I've been notoriously, throughout my life, had very bad balance. Most of you guys know that when I was younger, when I was 14, I was in a really bad car accident. So part of it stems from that. And then when I say I have poor balance, it means that, I've done the Ironman 5 times. So how bad can my balance be? But just, like you play sports such as golf or tennis or, there's different things that you do that require a high level of balance. So I guess I'm just saying based on wanting to be a better athlete, but most of my patients come in and the balance is really terrible. Some of them know what's causing it, like they have double vision. So obviously if you don't have proper gaze stability, that's going to give you balance problems. A clue that the balance problems from the neck is if the balance is way worse when you're driving in a car. Like you don't realize when there's motion or unless you're staying still, the balance is terrible. Any sort of motion, especially like driving in a car, that's likely going to be from your neck. And then we'll kind of talk about why that is. Now, most of us don't realize there's so many reflexes, which I just call balance reflexes, that is going on all the time. Even when you're watching this, your brain is getting so much input as to like how far is the screen, where's your head in 3D space, is the image of me getting to your brain on both sides at the same time. If you're standing at a computer watching this, there's spinal reflexes. It involves your eustachian tube, your neck, your balance nerve, your spinal cord, your cerebellum, your brain. All these things have to be coordinated for a person to feel like they have very good balance. And if you think about it, like what actually is balance? I would just say that it's where you feel comfortable doing what you're doing. Like you feel comfortable watching this and you don't have any sensation that's distressing to you, like lightheadedness, dizziness, vertigo, the sensation as if you're going to fall over. So you could see where there's ligamentous input to proper balance. There's eye input, there's hearing input, there's vision input, there's ligament input, there's spinal cord input. There's so many inputs. There's lots of different ways doctors check for balance. In our office, I basically have them walk and I get a good history, and then we do our neck vitals, and I'll go through some of the stuff we look for, and then we try to figure out the cause of the imbalance, but most of the time it's many things. I'll have patients tell me lots of different things. For instance, like when they're walking, they might lean more and more to one side. They might feel like one side of their body's weak. They may not have sensation on one side of their body. Or, like I said, when they're in a car, they might say, then I get really dizzy, I get lightheaded, And the traditional way doctors learn about proper balance is that a person's center of gravity has to go through their feet. So obviously a person, as they get older and they walk more and more, as an old person walks, basically their center of gravity isn't going to be between their legs, and if it gets too far in front, that's when they start falling. So in its simplest terms, you could say proper balance starts with proper posture, and that means you and I. The more I've got a forward head posture, the more I slouch in my chair, the worse my posture, the worse my balance is going to be. So it basically starts with there. And if the problem is, if you have instability anywhere and your body's making all these compensatory things, or you have your atlas keeps misaligning, like for instance, like say your atlas is misaligned, and for you to have level gaze, you have to tilt your head. You have to tilt your head a certain way. Well, the whole spine might change just so you have gaze stability. And this is a second major point. Most of the reflexes that occur and changes that occur in the body is for us to be able to see well, and we have gaze stability. For instance, like some people will have better gaze stability if their head is tilted. In other words, the brain is sensing proper balance when the head's tilted. So structurally, a person needs normal spinal curves and stability for, first and foremost, for the brain to know the head is balanced on the neck. If the brain doesn't think the head's balanced on the neck, the brain might say to be balanced, the head's got to tilt to a certain way. And a lot of this relates to the atlas. Like this just says, you get a loss of lordosis and all these things. There's so many compensatory changes occur just from a chronic instability in the lower back. Like you could have all these compensatory things happen just because of a hip problem, a neck problem, a thoracic problem. So you shouldn't ignore musculoskeletal pain, because your body's going to make all kinds of compensatory mechanisms that could eventually lead to balance problems. And this particular problem, that's what I was saying, like they're so forward that it's going to take very little to get them to fall and lose balance. And obviously this particular person, you could see where their spinal cord's getting compressed. So the spinal cord carries sensory input to the brain that's necessary for balance. Like I'm walking, right? So say, and the other thing too, you don't have good balance. Like I'm just gonna show you something, and this is what I mean, like I gotta keep working on my balance. So right now I'm standing on my left leg, and you could see I'm, so now I'm standing on my left leg. So watch this, okay? So I'm standing on my left leg. Now I close my eyes, like closing your eyes, it's so much harder. So let's be honest, like somebody should be able to stand on their leg and close their eyes and do it for a very long period of time. So I have very weak hip muscles. Like for the amount of exercise I've done in my past, I should have stronger hip muscles. So when somebody's walking and they're waddling, that's normally the gluteus medius muscles are weak. So those are some of the muscles that I'm starting to work on as I'm trying to get back in shape. So this particular person, the spinal cord is getting crushed. So that could lead to some balance problems. So the treatment in this particular person is going to be normalization of the cervical curve, and the instabilities right here, treat them with prolotherapy. I put this on here just that any human disease can have multiple causes. Because most people sit all the time, they have all these muscular balances that could lead to balance problems. So the most important muscles to stimulate to get stronger to help with balance is going to be the gluteus medius. Obviously, joint instabilities, especially in the neck and the lower back, that can give balance problems. Any sort of hormonal issue, mineral deficiency, lots of different things can cause balance problems, but I'm talking today really about the structural causes of balance problems. This just shows cerebellar tonsillectopia. The cerebellum is key to balance. One might even say that's the balance center of the brain. So anything that causes a stretch, compression of the cerebellum. And the most common cause I think of that is intracranial hypertension from jugular vein compression. So if you've been diagnosed with a cerebellum problem or cerebellar tonsillectopia or cerebellar degeneration, I encourage you to get an assessment. So the way we do it in the office is we check how open the jugular veins are with different neck positions. And some people, even during the night, the jugular veins are being closed, which causes an increase in brain pressure, which of course can affect the cerebellum, and it can affect the brain pressure and the balance center, which is the cerebellum. This just shows some ligament damage at C1, C2, causing an excessive accumulation of cerebral spinal fluid, and the increase in pressure causes the cerebellum to go in the foramen magnum, which then causes cerebellar tonsillectopia. Another common cause of balance problems is Meniere's disease or inner ear problems. So what's supposed to happen is sound enters the ear, and then basically eventually the cochlea or the organ of hearing, cranial nerve 8, then you hear. Well, many people don't realize cranial nerve 8 is the vestibulocochlear nerve. Eustachian tube dysfunction can affect the vestibular part of that nerve, and the vestibular part of that nerve is what helps you from falling over. So in other words, the inner ear has these semicircular canals. So they have these semicircular canals right here. The fluid flow in these semicircular canals, when it's normal, it's going to tell the brain appropriately where the head is in 3D space in relationship to the neck, in relationship to the body. However, if you have Eustachian tube dysfunction, so now the inner ear can't regulate its own pressure and fluid accumulates in the ear, that can affect the function of the semicircular canals, and now all of a sudden the sensory input to the brain of where your head is in 3D space is screwed up. Now you might say, well, okay, how will you know if you have a Eustachian tube dysfunction? There's a simple test you can do at home. Close your nose, then swallow 3 times and see if your ears pop. Okay, so today both of my ears are popping. Sometimes my right ear doesn't pop, so I have a little bit of Eustachian tube dysfunction on the right. If the side where it doesn't pop, if you have ear fullness, or you notice there's more earwax in that ear, or because earwax is just the fluid, this fluid going through the tympanic membrane, then the wax just accumulates. It's basically the fluid solidifying. That's what earwax is. So if you have an excessive amount of earwax, you probably do have Eustachian tube dysfunction, or you're just eating a lot of foods that you're allergic to or sensitive to. So don't negate balance problems as being from Eustachian tube dysfunction. So the treatment's going to be, well, you got to open up your Eustachian tube better. Now, the muscles that open the Eustachian tube, those are innervated by cranial nerves, including the vagus nerve. So I would refer you to other videos that I've done on the vagus nerve, but often those nerves aren't functioning correctly because of cervical instability. So if you have cracking, clicking, popping in your neck and Eustachian tube dysfunction causing balance problems, the treatment is going to be getting your cervical curve better and doing prolotherapy for the stability. So when I have ear fullness in my right ear, I'll take a Q-tip and I put it in there, and I'll just go like that just a little bit, and then all of a sudden where the water was, it comes out, and then my Eustachian tube opens and it drains, and then all of a sudden I can hear better. And whatever little bit of lightheadedness I have, it goes away. So again, things that stimulate the vagus nerve, you know, like that, there's vagus nerve stimulators, but you can also just go like this, you know, and then often that maneuver will cause the Eustachian tube to open and the fluid to drain. And of course, just a Q-tip also is stimulating the vagus nerve. So if I had a Q-tip, and obviously if you stick the Q-tip in this ear and it's dry and you stick it in this one and it's wet, you know, well, obviously the fluid from your ear isn't draining as good on this side. And the cause of that often is there's irritation, compression, stretch of the vagus nerve, and you need to get that resolved. So this just shows the vestibulocochlear nerve that we talked about. This is intimately involved in balance, and then we said the vagus nerve. If a person has jugular vein compression, it can also affect these nerves, which can affect balance. And then the cerebellum, if it gets really bad, a person's balance can get so bad that the neurologist will say they have ataxia, lack of coordination, eye movement disorders, nystagmus, trouble swallowing, all kinds of things that can occur. But again, at the Hauser Neck Center, we find that most of those things are from the breakdown of the cervical curve and cervical instability, and the evaluation that's needed is digital motion x-ray, and if instability is found, then get prolotherapy. This is a very important slide that talks about how your eye is tied to spinal reflexes and balance. So there's a lot of different reflexes. So the vestibulo-ocular reflexes, the eye gaze is stabilized during head motion. So in other words, that reflex, you know, make sure that I still have 3D perception when my head moves. The cervical ocular reflex is the eyes move in relation to neck rotation. So in other words, you know, like the eyes move in response to neck rotation, and there's still gaze stability. And the key thing with that reflex that's necessary is the cervical ligament and facet joint proprioceptors are working. So within the ligaments themselves in the neck, specifically the capsular ligaments, there's these receptors that basically help the brain know where the neck is in 3D space. So they give position sense information. So imagine if somebody had a whiplash injury, or they have a lot of ligament damage because they look down at their cell phone all day for 6 hours a day or 8 hours a day, and all the proprioceptors and the ligaments are damaged, then the brain isn't getting, or the brainstem isn't getting good information on what's the position sense of the neck. Then these reflexes are all going to have trouble. And you'll see that many of them depend on the ligament and the facet joint proprioceptors. And then there's many connections with the various nerve ganglion in the neck. For instance, the sympathetic nerves also join the vagus nerve, glossopharyngeal nerve, facial nerve, trigeminal nerve, and all these things are intimately involved in the various reflexes that are necessary for balance. You know, and we all know that, you know, somebody gets a head trauma, they get a whiplash injury. There's so many disorders that have also as a symptom balance problems. But I'm just saying that the central part, or the weak link in the system to me, is the neck. Like for instance, somebody has a balance problem and they go to the eye doctor and the eye doctor says the eye is fine. Or they might even go to the neurologist and the neurologist says, we can't find anything definitively. Like they do a brain MRI, brainstem MRI, neck MRI, and there isn't anything that explains the amount of balance problems you're having. Well, the most logical place is going to be you have ligament damage in your neck, so the proprioceptors of the neck aren't working. The breakdown of the neck curves causing intracranial hypertension, so that's putting pressure on the cerebellum. Then the increased pressure can also be on the brainstem, where like the vestibular cochlear nerve is. And then because the nerves to that open and close the Eustachian tube aren't working right, The person also has a little bit of Eustachian tube dysfunction. So they're just a setup for a lot of balance issues. And anybody who has cracking, clicking, popping in the neck and tension in the upper neck and has balance problems, it's likely that you have C1, C2 instability. C1, C2 instability can also cause vertigo, tinnitus, suboccipital headaches, fatigue, fullness in the ears. We talked about dizziness, balance problems, pain, blurry vision. I have this on here just to remind everybody that vagus nerve issues, cervical instability can affect the autonomic nervous system, and you need your autonomic nervous system to have proper balance. And when you have vagus nerve degeneration, you can have all kinds of symptoms: tachycardia, the stomach doesn't work right, swallowing difficulties, hoarseness, light sensitivities, all these different things. So if somebody has a lot of symptoms in addition to the balance problems, it's likely some of the symptoms are because of vagus nerve degeneration. What's needed is good evaluation of the vagus nerve, which we do here at the Hauser Neck Center. We do HRV testing, we do the diameter of the vagus nerves, and then we look at all these different things, and often the center of it's going to be the cause of the balance problem is cervical destructure or breakdown of the neck curve and upper cervical instability. And I'm just here to say that if the correct diagnosis is made of what's causing the balance issues, for instance, if it's postural, and we might send somebody to physical therapy. Ourselves, we might do curve correction. Obviously, I showed you, even me, I am a little bit at risk of falling just because my hip abductors are so weak. So I'm in the process of actually going to a physical therapist myself for that. And I also noticed that I have a really bad bunion on one of my my left big toe. So I don't grip as good with my left foot. So that's what I was doing this morning, just doing exercises to improve my grip strength of my toes, because you don't realize, most of us wear very supportive shoes, so we're not walking in our bare feet, right? So we don't grip our toes like we should, and believe it or not, that can lead to falling and balance problems. So definitely work on your grip strength, and the more you can walk in your bare feet, especially if you're having balance issues, do it carefully, but that also helps with balance. And I really do like one-legged drills, so one of the things I've been doing, you guys can't see it, but I'm standing on my left leg, then I'm abducting my right leg, because that's, and then try to stay as still as can, because that's going to improve my abduction of my hip, which will keep my hip level, when I'm walking and doing athletics and everything. But if you think you have a neck issue causing your balance issues, recommend digital motion x-ray, and then figure out which part of this milieu is causing the balance issues. And once it gets corrected, the balance improves. And for all of us to live to be 90, and let's be honest, let's make it all a goal to be active in your 80s and live to be 90, we have got to maintain the ability to walk, to be active. And that requires that we have proper balance.